Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Chris with us here this afternoon, all the way from Kansas City. And you guys have probably seen Chris all over the country, around the stage somewhere, doing his show all over. What's the name of your show?
Well, I'm with Tech 9, and Strange Music is the music label.
Yeah, Strange Music is the music label.
Yeah.
And he's been having problems with hiatal hernia for how many years now?
Since 2009.
Since 2009.
Like 8 years.
And what's been going on since then? What all have you done?
Actually, anytime I eat anything, especially bad food, I'll get, I can't breathe. Like all of the shows that people have seen me on, like I'm barely breathing during those shows and really struggling getting through them. And, you know, if any of you guys have ever been to our shows, you know how crazy me and Tech 9 are on stage. And so, yeah, how energetic it is. And so I've had to pull back some, even though that fans might not notice. But I've been having to pull back because I can't breathe from the indigestion.
Right. What have you been doing to take care of this medically or by yourself or anything?
I've had every test known to man for your digestive system. I've had colonoscopy, I've had endoscopies. I've been on every single acid-reducing medication that you can find.
And none of that really helped you, right?
None of this helps. I have a little concoction that I'll use, and after a while it'll help me with apple cider vinegar, but I have to take it for like a month and a half, 4 times a day, and it's pretty hard to take, you know, but yeah, to help, but nothing has really like yanked it away but that, and that was back in 09, and I feel like I've been taking it lately and it didn't even work.
And Bo from Nashville,
yeah,
he watched your YouTube video on your hiatal hernia, and he had the same exact symptoms that you had, right?
Right, yeah.
Isn't that what you told me?
Yeah, your video with Bo on it. Bo had everything I had, and including the constant belching, and everything to try to, he had everything I had, and that's what made me come in.
Well, and we're very happy to welcome you to Houston. He's getting treated twice a day now for 4 days in a row, so it'll be 8 total treatments, and those are going to be intensified throughout the week. He got his first one this morning, so we wanted to get an early on treatment to show you, and then we'll do one at the end of the week and show you what his progress has been and let you hear it from his own words. Okay, let's take a look at your posture here first then, Chris. And I'm going to have you sit over this way just a tad. There you go. Now, let's have you flex your head forward and then backwards for me, please. Now, we got a new camera and audio set up here. As you can probably notice on my ear here, I normally do not wear this around when I'm adjusting most people, but I am when we're doing these new YouTube videos.
Oh, I didn't. You know what? I didn't close my eyes.
You're okay. You're okay. And just stop at neutral when you get done. I can already see though. Now he's got a little bit of forward translation in his cervical spine. As you can see, his ear is dropping right here where his clavicle is, in front of his clavicle really, and it should be back up over here, over his shoulder. And you can see he's starting to get this little hump right here at the very top. Now, we call that Dowager's hump. Mostly in elderly women you see this, elderly men, but that's because of forward head posture. So, and that's also contributing to all the misalignments in his thoracic spine, which is crunching his rib cage forward and causing him to have a compressed type of not capsule, but really the upper cavity, I should say, the lungs, and that's decreasing his breathing capabilities, as well as putting pressure all the way down to the lower cavity into his stomach. So his stomach's slipping up through the diaphragm, and that's what we're going to be treating him for, is the underlying cause of it, which is mechanical through his mid-thoracic spine vertebra having a curvature or scoliosis in them, which they do, and we're going to be treating that today as well, and we do that with the decompression machine, which is manually done, not like the glorified traction machines that you see at a lot of the chiropractic offices, which do work, they just don't work quite the same way or as fast. That's why we have so many people coming here from all over the world to get treated, actually. Now look at your foot too, Chris. See how it's foot turned in on the right side compared to the left?
Yeah, and I have a little bit of pronation.
Yeah, that's exactly what that is.
I actually wear orthotics in there that I wear. I forgot what brand they are, but they're like about $400 or $500 a piece.
Mm-hmm.
So I got those.
Okay, so now that we have his posture analyzed, I'm going to go ahead and hook Chris up here to the decompression table, and we're going to pull him from his occiput all the way down to his sacrum, full spine.
I can fit in between here.
Yeah. There we go. Good. We got a lot of guys in here that are bigger than J.J. Watt on the Texans that we treat, so we'll fit those guys on here and fit you on here. So in this adjustment, you know, we're adjusting in the y-axis to take off compressive stress of the spine. So we get his legs up and parallel with the floor. That changes the angle here in the pelvis, so it helps relax the spine muscles. Now I'm going to put this wet towel, there you go, right under his occiput and his chin. Take a deep breath through your nose. Let it all the way out and just let it relax for me now. There we go. Good. Did you feel that all the way down?
Oh yeah.
Yep. Okay, so we got a good pull all the way down. We got much thicker pins now, so they're more comfortable on the iliac crest. Reflexes are there a little bit. They weren't even there at all this morning. So, okay, now let me just have your head completely. Okay, let me do the work. I got you. Let go and breathe. Tilt right a little bit. There you go. All right. Perfect. Good job. So that was a palmar cervical rotary break bilaterally in his neck from C2 all the way down to C7. So now what we're going to do, you hear Daddy popping? Sound like a bowl of Rice Krispies. I'm just pouring on the milk. Okay, let's come over here on your tummy now sideways. There we go. Now we're going to put this headpiece down a little bit so we can open up his thoracic spine joints. And we check his leg length just like every person, and his right leg is short this afternoon by about 1/4 of an inch. This morning it was about 1/2 an inch. And as I bring them up, you can see they start to get even. Now he's got a little bit of a right knee problem there too, so but see they get even. That tightens up in your low back right there, doesn't it, Chris?
Yeah.
So we know he's got a right sacroiliac problem right here. Even though he's not having a lot of pain here, he is getting some right hip pain down in here, and I think that that's probably coming from his right sacroiliac joint right now, which is what I'm adjusting in the x-axis and the z-axis. Hopefully this Bluetooth headset will allow you to hear what I'm doing on the tables more and also have better quality audio. We'll see. This is our first one, so you can let us know. Also, we want to thank you all for subscribing, watching, and sharing our videos as well as commenting on them. And if there's any conditions that you want to see us do a treatment on, or a condition that we have a patient that may have that condition, we'll be happy to ask that patient if we can do a video on them. We never do YouTube videos on patients who do not want them to be done. We always ask permission first. We get permission in writing, follow all the HIPAA regulations. Got good movement all the way through there.
Oh, yeah.
Say,
Did he have any movement at the top?
yeah. There we go. Okay, now I still got one more right here. Yeah, I can feel it there. Okay. Now, I'm going to put some pretty deep pressure in here this afternoon. We're going to work our way right into that thoracolumbar region. Right there. Well, that's really sore there. Keep breathing. There you go. Yeah, and right there too. Now see, right now I'm right at his thoracolumbar junction, which is where the lower rib cage attaches. Pretty sore all through here, huh?
Yeah, right there.
Yep. One of the main reasons that the stomach slips up through the diaphragm and secretes acid into the esophagus is because the diaphragm is really not strong enough to hold the stomach down in the lower cavity because of the ribs being misaligned with the thoracic spine vertebra, and the cartilage that the lower ribs are made out of that the diaphragm attaches to is torqued and tweaked, so it allows the diaphragm to weaken, and the hiatus, which is right where the opening is, allows the stomach to actually slip up into the upper cavity region, and that's where you get the secretion of acid into the esophagus. Also, a lot of people get a real fullness feeling in there, right below their sternum. Other people get like severe chest pain. That's what I had when I first had this. I thought I was having a heart attack, it was so bad. And that's how I learned to take care of hiatal hernia, is by me having a severe one myself and having a very skilled chiropractor work on me. And I paid attention and learned through the years and developed my own techniques as well. Now, we're going to show Chris's wife how to maintain some of this after he leaves here and goes back to Kansas City. A lot of people who are coming in from out of town, this is something you would want to consider, is bringing your spouse or a friend to come in here with the patient or with your spouse to let me show them how to help pull the stomach back down through the diaphragm, because if you come here for 4 days and you get this treatment, by that 4th day you're going to be feeling better. But when you get back home, you really do need to keep this up for a little while, because it doesn't just change overnight. You didn't get that way overnight, and it won't change that way overnight either. So we really recommend that you bring your spouse or a significant other into the office and let us show them how to help as well. Oh, there, feel that? This is a nice, I'm doing a lateral oblique stretch on him right now. We got some pretty good movement right down at the very base of his spine around L4 and L5. Yeah. There we go. Okay, now let's check his leg length again. Yeah. Look at there, it's exactly even right now, and I bet you this feels a little easier than the first one.
Yep.
Yep. Okay. So I'm going to bring out the big boy this afternoon. This is the Turbonator for all you guys out there that have been watching the Turbonator for a while. Just take some real deep breaths on this one for me. Find the sore spots, huh, Chris?
Yeah, that's intense.
Yeah, that's a deep one.
That's intense.
That's for the heavy duty hitters there. Did really good on that for your very first time. A lot of people are jumping off the table and get the old white knuckle syndrome, clinching onto the table.
I feel like he wants to do that, but
yeah, we did good on the first one.
I've had worse.
And then see, we do this to increase the blood flow into all the muscles and tissues, the fascia. Because increased oxygenation and bringing in of nutrition into the cells is a very important part of the healing process. But what we're also doing with this is relaxing his myofascia, which allows the blood to carry out the metabolic waste products of normal cellular metabolism, which is equally important, because when those toxins build up in these muscles, they get really sore. Those muscles form trigger points, and then those muscles will actually pull the bones out of place. Another thing I wanted to mention here too, that what we're working with a great deal in the treatment of the underlying cause of hiatal hernia is what's called somatovisceral reflexes. So viscera is the organs, and somato is the muscles. And there are always muscles, somato component, that is neurologically connected to a visceral component. So, and that's really what chiropractic is all about, is the proper function of the nervous system so that all of the organs, muscles, tissues, and cells. How's this feel, Chris?
That's good.
Okay, good.
It only feels like it's tender because I have so much damage that's been done to my knee.
Yeah, let's turn you on your back now, please. So somatovisceral, when I stimulate the muscles, that the same nerves there supplies his viscera, in this case his stomach and esophagus and diaphragm, we're getting a visceral reaction as well as, now here's the bad knee.
Yeah, you feel that?
Oh yeah. So I'm going to decompress that too. There we go. Should have felt that in your knee and your back.
Really?
Yeah, your back mostly. Okay.
Yeah.
Here you go. There. That one was mostly back too. The knees
Yeah,
are pretty stiff, aren't they?
Oh, yeah.
Yeah.
They
Okay.
want to protect themselves.
Okay, so you want to come on over here for a second and I'll show you how to do this one.
My baby's probably going to want to.
Yeah, well, you can
Yeah.
come help too. He looks interested. He's eating. He not having any acid reflux. Okay, so what we do here, see, this is the sternum. Like you feel right here, this is the breastbone. You come down below it and you feel right at the end of it, there's this little tip on it. Feel that little bone right there?
Yeah.
If you go down below that, you'll feel kind of a soft spot. And when we get down, you don't want to get on the tip of that and push down because you break that xiphoid process off. You go down below it. And I take these middle 3 fingers here, and in the palm of my hand right on top of it, take a deep breath in for me, Chris. Let it all out, and I push straight down first, and then I grab the top of his stomach and I pull everything straight down, superior to inferior. So I'm pushing down and then this way all at the same time. So what I'm going to do is I'm going to use your hand here on this one.
Come on, just touch daddy, buddy.
And put your there, and I'm actually going to help with the pressure. Take it. Now you want to start off real slow too. Take a deep breath in, let it all out, go in slow. You're going to grab the tummy, and then you're going to pull it way down and give it deep, deep, deep. Did that feel as deep as what I did it? Probably not.
Let me try.
Yeah.
Yours
So
feels
you
like- yours
Okay,
feel like-
so-
you want to put your hands on mine and feel how deep I go in there.
Okay.
Okay, there we go. Oh, that's it. Feel that real hard knot right there? That's his stomach.
Okay.
Now, pulling that straight down. There we go. Good. And you want to have him exhaling throughout that whole thing.
Okay.
And then actually, if you rub the sternum, that's sore right there too, isn't it?
Not too
Not too
much.
bad? 'Cause
Not
usually
too
the sternum gets pretty sore when you have
but-
hiatal hernia. You got some ribs out there though still. So let's slide you all the way down off that table again like we did this morning. A little bit more where your feet are almost touching the ground.
Are you done with Crystal?
Not yet, Kristen.
Okay.
Not done yet.
Oh,
Okay, so put your arm straight out to the side like this for me, Chris. Now don't do this one at home. And also, guys, you really don't want to be doing this hiatal hernia treatment on anybody at home either without me training you personally on doing it. Now, Crystal can do it at home on Chris because she has now felt what it's like, and I'm going to let her do it on her own a couple of times before they leave to go back to Kansas City. So right now I'm adjusting his clavicle where it meets the sternum and his costochondral joints right here where the ribs meet the sternum. Costo meaning rib and chondral meaning the sternum. Chondral is the actual rib, I'm sorry. And then, there we go. Costosternal is what I'm looking for. So I'm adjusting every one of his ribs all the way down. Right there. Okay. Now, while you're in that position, Chris, take another real deep breath. Let it all the way out. Sink down in here. Keep exhaling. You want to keep exhaling real hard. There we go. Good. Now, I usually get down and work into the ileocecal valve on this too, and I do a clockwise type of rotation down. Is that sore right in there?
Yeah, a little bit.
Yeah. A lot of times, like popcorn and nuts, things that have husk on them will get stuck in the ileocecal valve and can cause some intestinal difficulties as well. A lot of people that have hiatal hernia also have some other types of gastrointestinal disorders as well, gastritis, diverticulitis, ileitis, things of that nature.
I've been tested for all of it. I don't have any of that.
Yeah. They said there was nothing wrong with you, right?
Well, they said they didn't know.
Right.
They said.
How many times have you heard that? Don't know.
I don't know.
Take these pills for a couple of weeks and we'll see how you did, and if those don't work, we'll give you some more.
Yeah, let's spin this story for the last 8 years.
Very good. Okay, now let me help you sit up. Let's face towards Renee sideways here. There we go. Good. When's your next show, by the way?
Saturday we play a summer jam in Seattle.
In Seattle.
Yeah.
Be nice and rainy up there too, probably.
Well,
Probably not like here,
it's
though.
gonna be. It rains there every day. It's gonna be sunny that day.
Oh, good. There you go.
I heard that.
Yeah. They're down here. You guys in here just in time for our tropical storm in the
I know.
spring
All
here.
right.
But it's
Yeah.
raining back home a lot too, so.
Yeah. Well, we just got done with some pretty massive floods here in Houston a couple weeks ago, and we've got this tropical storm coming in out of the Gulf. If it turns into a hurricane, they're going to call it Bill. So,
Already got
What
a
do you
name
guys
for
do
it.
when you get a hurricane? You just
no, we just
keep it going.
we like it. We love the big old Texas Thunder Boomers ourselves. I mean, you know,
So
we
you
want
just
our
keep business
patients
as
to be safe. Yeah, it's business as usual for us. We usually come in and see patients, and some patients come in, some don't.
I'm across the street.
Yeah, you're across the street in Hyatt. So.
Yeah, exactly.
That
I told
works
them,
out.
as long as they can make it into the
That's
office,
it.
we'll be there.
And we'll be here if we can, unless there's, you know, hazards on the road. So we finished up everything as far as his adjustment and pulling his stomach down now. So let's come over here and shoot you now, Chris.
Okay.
Alright.
Oh, you're all right. You don't have to be sorry about anything. This is a high velocity, low amplitude Atlas specific adjusting instrument that I utilize to adjust the Atlas on the X-axis. So I'm going to have you close your eyes again, Chris, and go forward and backwards one more time. And remember what this feels like. Now, see, he's already got an improved range of motion.
I can tell, and I feel like I'm standing up.
You are standing up straighter, but we're going to get you to pull these shoulders way up and back and hold them there for me. Flare these hands out, palms forward. That'll tighten up the entire trap. Then see if we bring his head straight back in the Z-axis. See from the side, his ear is now over his shoulder.
Yeah.
And he is translated a little bit to the right, so we're going to translate him exactly opposite of that. We're going to adjust the Atlas while he's in this mirror imaged posture. There. And there. Good. Now relax. Okay. Now, when you go forward and backwards this time, tell me how it feels versus last time. It should feel a little bit smoother this time. And then neutral. Okay, so he's definitely standing up better. Yeah, your shoulders aren't rounding as much. And the way I can tell that too is the hands come more down to the sides as opposed to being out front, which is this is where they were this morning. So now they're coming a bit more back here, but we still got some work to do. And I've given him exercises to do at home where you lift up with the traps, pull back with the rhomboids, flare these hands out, palms forward. That tightens all the traps up, and then bring your head straight back. And then look up to the ceiling. You can even reach up with your index finger and tap right under that bone right there. That will send neurological impulses into his cerebellum, which controls balance, posture, coordination, and all kinesthetic movement in his body. Okay? Relax and just flex forward one more time, see if that feels any easier. And you do those exercises 15 times in the morning in neutral, 15 times at night, and 15 times around lunch sometime. Excellent. How's that feel right now standing there?
It feels pretty smooth.
Okay, good. Okay, this is Chris, and this is your Houston Chiropractor. We'll see you next time.